Hey guys, so I'm going to be talking about myocardial infarction, also known as a heart attack, during this presentation. Coronary heart disease is the most common cause of mortality of men and women in the United States, and myocardial infarction, or MI, is the most common complication resulting from heart disease. There are many risk factors associated with heart disease that can eventually lead to an MI. These are listed on the slide. A myocardial infarction is the irreversible death of myocardial tissue due to a lack of oxygenated blood flow. The most common cause is by plaque detachment from the vessel wall, which creates a thrombus and obstructs the blood flow. The picture on the slide shows how plaque in the vessel can block the blood flow. And as you already know, there are two types of MI, a STEMI, which is ST segment elevation myocardial infarction, and a non-STEMI, non-ST segment elevation myocardial infarction. So when you hear the words heart attack, everyone immediately thinks of the typical Hollywood presentation of chest pain. Levine sign, which is clutching of the chest, the pressure, the heaviness, the elephant sitting on my chest pain, the pain radiating down the left arm or up the jaw, and the pain typically lasts greater than 30 minutes and usually occurs at rest. But also associated with MIs are nausea, vomiting, shortness of breath, and diaphoresis. However, there are atypical presentations that exist, like in women, diabetic patients, and elderly patients, and they don't necessarily have the typical chest pain. So it's important to be aware of these atypical presentations as well. The physical exam is pretty nonspecific to a heart attack. It kind of varies in patients. They can present differently with a variety of symptoms, but they will usually appear in distress. So labs and imaging are the keys in determining a diagnosis of an acute MI. Cardiac biomarkers are lab values that are used to determine if and when a myocardial infarction occurred. Myoglobin is released 1 hour after injury occurs, but is non-specific to the heart. It's mostly used to rule out an MI. CKMB is used to determine if reinfarction occurred due to the early clearance. And troponin is the most specific to cardiac tissue, making it the standard marker to determine myocardial injury. The graph on the slide shows the peak and clearance of each cardiac enzyme. The two types of MIs are differentiated by electrocardiogram, or EKG. ST segment elevation and contiguous leads are the definitive diagnosis of a STEMI. However, if no ST segment elevation is noted but the cardiac biomarkers are elevated, then the diagnosis of a non-STEMI can be made. On EKG of non-STEMIs, you can see ST depression or T-wave inversion. This slide just shows the contiguous leads that are associated on the EKG. STEMIs are medical emergencies, so rapid treatment is essential to prevent increased morbidity and mortality. Rapid reperfusion of oxygenated blood flow is the ultimate goal in treatment. Initial medical management includes a variety of medications such as MONA, morphine, oxygen, nitrates, and aspirin, which is part of dual antiplatelet therapy. So it's aspirin plus another antiplatelet such as clopidogrel. Quick reperfusion of the obstructed vessel can be accomplished in two ways: fibrinolytic medications and percutaneous coronary intervention, also known as PCI. So fibrinolytic medications such as alteplase or reteplase is used if PCI is unavailable at the facility. But PCI is the most commonly used method. This uses emergent angiography to identify the blocked vessel, which is then opened by a stent. So the picture on the slide shows how a stent is placed. Also, anticoagulation is important to include in treatment because this can prevent clot extension and reformation. Such drugs are enoxaparin, low molecular weight heparin, or direct thrombin inhibitors. So prevention and patient education are important to convey to decrease the risk of a myocardial infarction. Prevention should begin with risk factor modification. These include smoking cessation, dietary changes, and better control of diabetes. It's important to continue dual antiplatelet therapy if the patient had a stent to prevent clot formation of the stent. Other medications used are beta blockers, high-intensity statins, ACE inhibitors, or ARBs. These medications should be started during acute treatment and continued after hospitalization. So patient education is very important so patients can understand that heart attacks can be preventable. So thanks for listening, guys.